Great. Well, it looks like we're hitting a couple minutes in, so why don't we go ahead and get started? So today we're going to be talking about direct primary care and how to bring it to your employer groups. Today, for presenters, we have Dr. David Cameron, who's the president and CMO of Hint Connect. He's joining us from Denver. Myself, Beth Holmes, I'm the head of network development here at Hint Health. My job is to bring employers and DPCs together so that more employee-sponsored employees can have access to direct primary care. And we're also joined by Ji Xiao, our network development manager here at Hint Health, who does all things provider with us. Today we're going to be talking about what DPC is. I think most people who are here already know, but we're just going to make sure we're all on the same page. Why employers should implement DPC, give you some resources through a DPC case study library that can arm you as you're going to talk to your employers about the value of DPC for employers. We're going to be reviewing the advisor perspective. So, what we're hearing from the advisor community through both discussions and surveys about challenges and excitement around implementing DPC. And then finally, we're going to spend some time talking about Hint Connect, what it is, its key benefits for employers, and how you can work with Hint Connect to implement DPC for your employee groups. And we'll have some time for Q&A. So all of this hopefully will take about 25 minutes, and we'll have quite a bit of time for Q&A or let you get some time back in your schedule. Can everyone see this slide here that says, what is direct primary care? Yep, all right. So Dr. Cameron, over to you.
Great, thank you. So I'm also a direct primary care physician as well as my role at Hint Connect. And direct primary care has been very different than the way that I practiced when I was in a traditional practice. So it's a primary care model where there's unlimited access to a full service primary care that's simple, flat, affordable membership fee. There's no billing of insurance. And most direct primary cares are small practices, independent providers, and they're small business owners. And then they develop relationships with patients, and they are accountable first and foremost to their patients, not to other entities. And the biggest difference, because there is no fee-for-service payments, direct primary care doctors can have very small panel sizes. Most direct primary care practices have about 800 patients per doctor. And in comparison to a traditional practice in primary care, most traditional practices will have about 2,500 patients. And so as a result, you have more time. I always tell, when I'm recruiting direct primary care docs, I always tell them you'll have 2 to 3 times as much time per patient. And then as a result, it's easier to get patients in. And so we promise same day, next day access for our patients. And as a result, we can have more time so we can be able to get down into some of the obstacles about why patients are having difficulty. We can manage chronic diseases. We can do procedures. Let me give you an example. So I had one patient that came in because she had a bladder infection. And so she left a urine sample, and we're waiting for the results to come back. She goes, "Oh, and by the way, I've got a wart on my foot. Can you treat that?" And so I said, "Sure." And so as I'm treating with liquid nitrogen on her foot, we also reviewed on our patients. We will do a depression and an anxiety screen, and she had an abnormal result on her depression screen. And so we did the full screen for depression, and clearly she had depression. And so once we treated her for her urinary tract infection, treated her wart, then we addressed her depression, which was not why she was coming in. And actually, that was the thing that was most troubling to her and causing her the biggest disability at home and at work. And so it was great to be able to address multiple issues to take a biopsychosocial model of care for our patients. And as you can see, if you're able to take care of all of these issues in a fixed cost system, you can be able to decrease the costs downstream. You can decrease hospitalizations, decrease utilization of other services and other specialty visits that might not be necessary. And as a result, because patients can get in, they can access care through text, through virtual, through longer visits, it becomes a much better patient experience. If we take a look at the next slide, there's some data that we can take a look at. Let's see here. I am not seeing the next screen. Is there a way? Maybe what I'll do is I'll just go to. So here it says direct primary care by the numbers. Average adult per member per month is about $65 to $80 per member per month. There's no copays. The average increase in membership fees over 3 years is very low. It's 1.5%. As you can see, that access is very high. It's one of the top tenets of primary care, that we can get people in a very timely fashion. Some will even offer urgent walk-in appointments. We prefer to have patients make appointments if possible, so that they don't show up at the same time as somebody else. And you see, on average, 38 minutes is spent with patients per visit. And if you put that into perspective in a traditional practice, the highest billing code, which is only used 5% of the time in traditional practices, that's a 35-minute visit. And so in direct primary care, that's the norm. And there's 75% fewer patients per provider. And we have a very high percentage of patients, 68, which is really good, comply with preventive care guidelines, because we have time to discuss the pros and the cons. And as a result, we get a great member experience. And so the NPS score, we have 70+% NPS scores, and great satisfaction rates, as you can see here. Now I'll pass it back to you, Beth.
Okay, thanks, Dave. Just toggling the slides here. So, when I talk to advisors, a lot of them say, how do I tell the story of DPC to my employers? Where does the benefit come from? So you want the high-level concepts and also the nitty-gritty numbers. So we're going to talk about both of those today. So in terms of the high-level concepts, employers are investing in primary care. They're spending probably 2 to 3 times PMPM for direct primary care than what they currently spend today, if they have people using direct or regular primary care in a normal fashion. So, what's the difference between the investing in direct primary care versus, offering a broad PPO primary care network that people can go to when they want or not? A really important concept that Dr. Cameron talked about is that accessibility. So when you don't know, as you go into primary care, what your cost is going to be, and if they're going to be open, it is a barrier for people going into primary care. Whereas with direct primary care, the DPC is patients' first line of defense when they get sick. It's not just, hey, I got burned, do I need treatment, or can I treat it at home? It's, should I go to the hospital? Where should I go for specialty care? Where should, is this an ED visit, or can I see you tomorrow? And the direct primary care doctor is there to answer that question. It's not a voice, kind of a machine message that says, we're not here right now. You can talk to a nurse that's in a different state who's going to not really give you any information or be able to schedule an appointment for you, which I know we have all encountered in fee-for-service primary care. It's someone who knows you at the end of the other line saying, hey, run to CVS and grab some burn cream and then come and see me tomorrow. Or, yeah, that looks really bad. Why don't we meet and we'll see each other right now? Or get yourself to the ER because, it's a true emergency. So having the DPC is like having someone in the family who's a doctor. And the effect of that is that there's less urgent care spend, less emergency department spend, less specialty spend, because as Dr. Cameron alluded to, DPCs have more time to spend with their patients. So in traditional fee-for-service primary care, primary care doctors are held to a quota, the number of minutes that they have to spend with patients or the number of patients they have to see in a day. And so when issues come up that they're trained to care for, but they don't have time to, what happens in fee-for-service primary care? That gets sent to a specialist. So then instead of having, a visit that comes in that's maybe costing the employer $90, you get a $90 primary care visit plus a $200 specialty visit, plus whatever, imaging and whatever kind of downstream care the specialist recommends. So because the primary care doctor is there after hours, same day, next day, virtual, you're reducing urgent care and ED, you're reducing specialty spend. It also replaces piecemeal solutions. So I'm sure as advisors, you have kind of a whole kind of treasure trove of solutions that you have been able to put in place for your employers that are telehealth, chronic disease management, like specifically diabetes management, at-home diabetes management, weight loss vendors, EAP. These are all things that DPCs do. So those solutions are in place because members are not getting access to really strong primary care. Doctors who know them, doctors who know their story, who know the behavioral, social, medical parts of the story. So there's piecemeal solutions out there that are trying to kind of fix one little part of overall health, whereas the DPC is looking at the whole person and whatever chronic disease or issue that they're dealing with at the time. A really important part of how DPCs can drive cost savings too is driving care to efficient specialists and facility care. DPCs are already used to working with their members to make sure that when they're sending their members to specialists, to hospitals, that it's going to be a good experience for them, that they're sending them to quality providers who refer them back to the PCP after that care is done. So they have that feedback loop of what the patient experience was. And they DPCs know that their patients are cost conscious because up to 40 to 50% of most DPCs membership is uninsured cash pay patients. So they know this is if you go to a specialist and they run $1,000 test, that can mean a real trade-off for an individual, whether they're employed or unemployed. $1,000 it can go by really quickly when you're spending it on healthcare, but is an incredibly meaningful amount of money for most people. And so, that is something that DPCs are already working with their patients on. When we are able to provide information that you give us, that the TPA gives us, that the employer gives us on where they want their members to go, that is information that the DPC wants and they can use to make really smart decisions for the member and for the employer from a cost and quality standpoint. I know you all know recruiting and retention, employee wellness, these are harder to measure. This is more kind of the qualitative benefits of DPC, but in a really tight labor market, offering a differentiated benefit creates employer stickiness. And from everything that I've heard, when DPC is offered, you get the sense your employer actually really cares about employees. And I know if you're a benefit advisor here and you're in the DPC world, like that, those are the groups that you're working with, ones that want to create something a little bit different, actually care about member experience, actually care about employee wellness. And DPCs operate about 70% of care virtually because they're not incentivized to bring people in so that they can get paid. And this is better both for the DPC, but specifically for the member, because we all have busy lives. We're all working 40 plus hours a week. When something comes up, it is not on our work schedule. We have kids. A lot of people have more than one job. So when you can access your doctor who you have a strong relationship with via text, via phone call, and actually get medical advice, not just get a nurse who says, oh, you should probably come in, and that's the most that they'll say to you. That really allows people to continue to live their lives and stay healthy. So those are the talking points. That's the story. We also are excited to show that we have aggregated 10, actually now it's 11, of the most recent relevant DPC case studies, because some employers want the story, a lot of them want the data, and some of them want data from a group that's like them. Some of them want data that's peer reviewed. Some of them want it from big groups, small groups, and some want to see it all together. You have different employers who have different appetites for data. So we've aggregated these case studies. It covers over 13,000 aggregate members, and it has clinical, cost savings, and utilization metrics reported, including metrics around how often people see providers. Because I think one fear is that when there aren't claims produced and you can't see the claim, are doctors doing anything? And I know that's a kind of a sensitive question to ask, but it's something that employers ask and advisors want to know. And so you have the data here, and we will share this. I can share it with the group who comes to this webinar, and then eventually hopefully in a couple of weeks, we'll get it up on our website, where you can pick and choose from all of these studies to create the case for the employers that you're working with about why DPC is proven, cost effective, good for members, good for health. I see questions are coming through. We'll address these questions at the end of the slide. So just as an FYI, I see those. So yeah, we're excited about this, and we'll share this out. One of the things that it's important for us to understand as we're working with DPCs, and it's important for us to share with our DPCs is, what are the challenges to implementing direct primary care? Because it's a new concept. It's, out there's probably fewer than 4,000 DPC locations compared to, a huge fee-for-service system. How can we get this in front of employers? And how can we make this more mainstream and make this easier to implement so that it becomes the standard of care? And that's our mission at Hint, to make direct care the standard of care. And instead of, fee-for-service, that's really just hobbling along, both for providers and for employers. So what we've heard, the biggest challenge to implementing DPC is no DPC in our area. And I know there was a broker who emailed me before this and said, hey, is there anyone in San Diego? And I looked, still no one in San Diego, but DPC is growing 40% year over year. We've seen that growth for the last several years. And as I run geoanalyses for advisors and employers, it seems like every few months, my numbers go up. So 80%, 80% DPC coverage, 90% DPC coverage. I think almost always am hitting 90% DPC coverage in the geoanalyses I've been running lately. So DPC is growing. If there wasn't DPC there before, look again. So we can't solve that, but we are trying to solve several other challenges that advisors have told us about through Hint Connect. So those would be DPC network, no DPC network to plug into, difficult to administer major employee benefit change, especially when it deals with provider network, not understanding the ROI on DPC. That goes back to the DPC case studies. And if you have claims, we also have an ROI calculator. DPC contracting complexity, how on earth, everybody loves, direct contracting now, but are we expecting employers to hold a suite of contracts with all the providers in their area and become contract administrators, become provider network administrators? That's a really big task. That's not an easy thing to do. And it's it becomes a legal liability and legal risk for employers. If something goes wrong with that contract, it's an additional kind of competency that they have to have. And for small employers and even medium-sized employers, that's not really kind of fair or reasonable to expect them to hold many contracts with different doctors and facilities. DPC isn't transparent enough without claims. So, what's happening? Where is this money that I'm spending going? And we don't understand the DPC model. So everything that's highlighted here, Hint Connect is designed to help you with, and Hint Health is here to help you learn. So, the Hint Connect benefits to employers are, I think this slide is out of order on your one. So we'll get to that a little bit later in the presentation. Hint Connect for employers, we have created a DPC network that has now over 30, I think 30 is low. I think we've signed a new provider that's bringing on over 10 practices. So over 40 practices throughout several states. Right now, we're in Texas, Arizona, Oklahoma, Colorado, Florida, and entering into Missouri. This will be a national network by next year. So DPC across multiple markets for those employers that are spread out, which are many of our employers, especially post-COVID or in the times of COVID where people have gone remote and moved to the areas that they want to live in. We do everything from A to Z for DPC. So we are plug and play DPC, everything from educating employees, implementing the benefit, creating the network, and tracking patient satisfaction. So 30 employers now, many more to come. Ji, my colleague, is going to talk to us more about our network strategy and our provider strategy. But this kind of from A to Z is how we work with employers and brokers, and TPAs. So starting off, kind of pre-client status, we're conducting geo-analyses for you. So is there DPC where the employer group is? And that, we'll run a geo-analysis for anyone. So if you give us a zip code file, we can tell you whether there's DPCs that match those employees. Targeted network build for client-specific demand. So we are in kind of turbo network building mode. We will build to where demand is right now. So if you are looking at the map that Ji shows you later, and you said, well, that will cover half the employees, or that doesn't cover any of my employees, talk to us. We're building to where people are telling us the need is, so we can build to where your clients are. Then benefit rollout, comprehensive education and marketing campaigns to educate members on DPC. This benefit is an investment from both the employer side and the employee side, because going in for an hour appointment with a doctor to get kicked off, building that relationship, that takes time from the employee standpoint as well. So we want to make sure people really understand what DPC is. It's not concierge, it's not urgent care, it's not near site on site. This is relationship-based primary care where you have the time to work on yourself with someone who cares about you. And so that's really different than what most people have experienced so far. So educating people using, with our marketing team, with with the way people are used to getting information, whether that's email, video, on-site, so that employees know what they're signing up for. And then promoting the benefit, including having providers on-site, either actually on-site if it works out geographically via video or pre-recorded video, so employees know who they're signing up with and who they're starting the relationship with. Then technology enablement. Hint is first and foremost a technology company. So we have networks and affiliates technology that we're running Hint Connect on. This is completely within our wheelhouse. This is our kind of what we're really good at. So for the employers who are like, well, how does this work? How do I manage the enrollment, eligibility, membership, payment, invoicing? We have that covered. That's what we do every day. We have 30 networks running on Hint OS. We have I think over 600,000 lives running on Hint OS. I think that might be really low. Someone in my chat can correct me. But the kind of everything, the guts of it, that's on Hint OS. We've got that covered. That's our proprietary technology. Then finally, performance tracking and growth. So as the benefit rolls out, we want to make sure people are actually getting into the doctor. So having that first appointment to start the relationship is really important. We're messaging to make sure that the benefit is being utilized, that it's not something the employer is paying for and then not being used. We're working with our EMR partners with whom we're already integrated to get employer reporting set up for both encounter data and clinical data. So for employers who are really used to seeing a lot of claims data and want that level of specificity, claims are an indicator of what's happening clinically. We have a direct source into the EMR to tell you what's happening. So, it takes a little bit of adjustment for the employers to say, well, I'm used to claims, I want claims, I see this all in claims, and that's the way, everything works. But we have deep capabilities for reporting about how members are using the benefit, what's happening during a visit, and what the clinical outcomes are that are showing up in the EMR. And then also tracking member and employee satisfaction to make sure that everyone is satisfied with this offering. So that's the A to Z of how Hint Connect works. And what really sets us apart here at Hint is that we already have relationships with a majority of DPCs in the US working with employers. This is the Hint OS footprint. So this is everyone who's using our technology, and they, our Hint NPS score is usually hovering between 85 to 90. People who use Hint really like Hint. And when Ji and I call them and ask them if they want to participate in the network, they're really excited about it because they know we're a DPC first company. And that's what sets us apart from other entities building DPC networks. Unknown entities coming in. If you haven't guessed it, the DPC crowd can be a little bit wary. These are people who have left the fee-for-service system. They're doing something on their own. They're small business owners. They've taken a huge risk to be able to practice medicine the way that they want. So they don't want another intermediary in the middle coming back in, kind of taking part of their fees, inserting themselves in the direct care relationship. But when we work with them, they know that Hint understands direct care. And they're excited to work with us. So that's a huge differentiator that Hint has building this network versus kind of other DPC network builders. Okay, so I'm going to give you a break from hearing me continue to ramble on and hand it over to my colleague Ji, who can tell you about how we're creating our network and a little bit more about selecting providers on Hint Connect.
Thank you, Beth, for the thorough overview of DPC. I'm really excited to take a few minutes and talk about our curated network, Hint Connect. Really from inception to implementation, we've asked for and iterated based on inputs from providers, brokers, advisors, and employers, all the key stakeholders in the ecosystem. Because our mission is to make awesome primary care more affordable and accessible to all. As Beth mentioned, based on all of our conversations with providers to date, as we're active in Texas, Colorado, Arizona, Oklahoma, and Florida, barring that their panel is full or they only want to work with retail membership, everyone's really thrilled about joining Hint Connect. And hot off the press, we are expanding to Missouri this quarter as well. So last but not least, I just want to mention that many of you are probably familiar with the chicken and egg dilemma when it comes to implementing DPC benefits, right? Do you secure the providers first? Or do you try to identify DPC providers once an employer has shown strong interest in implementing this benefit, right? There's really no right or wrong answer here, and that's why we can help you source demand in tandem with building the supply to make your job easier. And as we roll out Hint Connect, I just wanted to take you through a couple of the feature highlights that we know employers and employees will love. We really take our cues from all of you in the DPC community. And one of the goals is to make sure our providers really stand out in the marketplace. So that way, right, the prospective members can select someone they're really going to like and they know they're going to have a meaningful relationship with. We know primary care providers are the quarterback to the member's health. So our provider profile page is designed to surface a myriad of really pertinent information to ensure there's full transparency in this network. Upon onboarding, we gather data including their bio, patient testimonials, their specialty, education, etc. from their website. And then once that data is confirmed, we will ingest all of it into HintOS and then curate a really complete profile to attract employers and prospective members. And moving on to where we're at currently, I know folks are really excited to hear about Hint Connect, and we're definitely expanding, right? We know there is a need for an Etsy-like platform where there's an aggregation of all the independent DPCs. And this is where we're also very proud of our ability to enable multifaceted provider search if you are looking for providers, right? If you ever accrued a migraine from shopping for a provider on one of the more traditional BUCA provider directories, you'll know it's really challenging to narrow down folks with more than one criteria at a time, right? So we enable our stakeholders to search based on provider clinic location, their specialty, membership cost, and more. So this is definitely something that we know employers will love. And last but not least, I know folks are probably wondering in the audience, right? How are we standardizing services across all of these really passionate, independent DPC providers, especially if an employer could be multi-site cross state lines? So one of the most attractive aspects of DPC is that the providers are in the driver's seat and they're dedicating their practice and career to providing high quality, accessible, and affordable care. So upon joining Hint Connect, we make sure there are unlimited visits for primary care, preventive care, urgent care, chronic disease management, and coordination with specialists for all of our providers. In addition, we also ask that they provide after-hour access and electronic communication access to maximize availability to the members. And as a result of them having smaller panels, stronger relationships with their patients, these providers can then help triage and ensure there's minimal wait, same day or next day appointments available. If an employer has preferences for specific types of services outside of the ones listed here, we'd be happy to work with you to make that happen, because there are many common services that are being offered by DPCs, including discounted labs, imaging, women's health, etc. With the right opportunity, our providers are very open to offering customized membership plans to service the members accordingly. And now I'm going to turn it back to Beth to talk about all the benefits of Hint Connect to employers.
Thanks, Ji. I think my slides kind of jumped around a little bit, but I will go back to our checkbox slide. You know, we can't solve every issue with DPC. You know, we're working with the AAFP to try to get favorable DPC regulations passed. It's still incompatible with HSAs. So, you know, that's a barrier, a real barrier that, you know, it's hard to overcome for employers. We're not building DPC clinics yet. So if there's not DPC somewhere, you know, we do have virtual providers. You know, we're big proponents of in-person DPC. We think that's really where the magic happens, but we have virtual first primary care providers where you see the same PCP over and over, you develop that relationship, it's just virtual. So, you know, we're trying to solve the there's no DPC here problem, but everything else about implementing DPC, you know, finding the DPC, contracting with them, managing all of the guts of it, the eligibility, enrollment, invoicing, payment, being transparent about our fee. You know, we're not adding 10, 25, 30% to the DPC's fee. Dr. Cameron will tell you about that in the next slide. Like, we're trying to really be value add in the spirit of transparency. And we're telling providers how much we're charging. We're telling, you know, employers how much we're charging. It's not, you know, there's nothing hidden here. And I think that's aligned with a lot of the advisors that I talk to with their ethos as well. We're educating about DPC. We're standardizing the services for an equitable benefit across DPCs, across geographies. We're arming you with that reporting on utilization and clinical insights. and helping you with the ROI and marketing materials for employer leadership. So it's not another kind of document you have to do yourself as you're having these conversations with employers. So, we're trying to make this as plug and play as possible. This is a new offering. This is year 0.7 for Hint Connect. So we're also still learning, and we welcome feedback about what we're doing. We're excited to get this started. We have, I think, 3.5 clients now on Hint Connect, and we're learning every day from them. So we hope that this resonates with more of you and your employers as you're talking to them about options for this year or next year. So I'm going to flip back to our pricing slide, and Dr. Cameron will talk a little bit about pricing.
All right, let's see, pricing. So provider fee, there's actually some variability. Earlier I mentioned that the average is around $65 to $80 per member per month for an adult. That includes contracted services. Now, the range can be quite large, and we've already talked about there's a specific number of services that we require, but some providers will do a lot more. Some will actually pay for the labs, pay for some radiology, some medications. They may have a wellness coach. They may have a mental health therapist on site. And so they do have some will have a higher per member per month cost because they will offer above and beyond what is the basic expectation. Now, some people have also said, hey, gosh, there's some large DPC or value-based providers that are out there that charge a lot less. And one thing to keep in mind is that all of our DPC providers are going to use what's called an opt-in model. So that means that patients need to select the DPC, and the DPC is only paid if that patient joins that. So one of the things that we recommend is to have that opt-in model so that we have patients that are engaged and are using the service. And so there is high value attached to that. Now, some organizations, they will do an all-in model. So they say everybody that is on the benefit plan goes to a direct primary care. And they may charge a lower fee, but once again, it's a lower fee, but there's a much lower utilization, and the value is lower because there's not as much utilization to decrease those downstream costs. Now, Hint, our whole goal is to be able to build this network, to be able to access the Hint Connect providers and to connect to employer groups. And we do have an administrative fee, which is much lower than many other networks. It's $3 to $5 per member per month, and that really depends on the services that are required from us. And there's no minimum in terms of the number of employees that are on that benefit plan. Okay, I'll pass it back to you, Beth.
All right, awesome. So it looks like we've gotten some questions coming in from the audience. There's a Q&A box there. So if you have more questions now, feel free to type in. We had a question from Christian. Will you be providing a copy of the slide deck to attendees after the session? Sure, we can absolutely do that. We'll also be providing the kind of a pre-release of the DPC ROI library. Howard, you asked, speaking of specialists in elective treatment, like a knee replacement, how do DPCs now help with cost-effective solutions? There's a lot of different options out in the marketplace right now. One way, DPCs have developed over time their own relationships in the market, in their own markets with specialists who usually offer cost-effective and cost-transparent care. A knee replacement might be beyond what people are paying out of pocket from a cost, a transparent cost standpoint, but maybe not, depending on their insurance status. So some of it is DPC sourced. The employer is welcome to provide that information to the DPC because, as we know, there can be 100 different prices for the same service at one facility, depending on the contract and who walks through the door. So if the employer has gotten deals that kind of direct contracting deals or through their whatever intermediary they're using, whether it's reference-based pricing or traditional insurance, and they have high performance networks, we can give that information to the DPC to do that. There are also many tools out there in the marketplace that are rating providers, specialist providers in hospitals, allowing them to offer cash pay prices through an open marketplace. So we're figuring out right now how to surface that information to DPCs when they need it. And there are some kind of partnerships going on there. So if you have other suggestions, we would be happy to hear them. Andrea, you asked, what's the average size of employers that contract with DPC? How many employees? Right now on Hint OS, the average number of eligible lives is just under 70. So really small, and that's grown over time. And what we're trying to do through Hint Connect is allow the kind of upmarket providers or upmarket employers, 50 to 100, 100 to 2,500, even kind of large ones and jumbos, to be able to access DPC. Because prior to Hint Connect, unless you were in an area that already had a network solution that perfectly fit your members or could grow to them, you really couldn't implement DPC for more than a couple different sites without it becoming really, really difficult administratively. So right now it's pretty small, and we're trying to break that open for larger employees. John, you asked, does the $50 to $120 PMPM cost include additional services? In some cases it does. So on that provider profile, it will tell you beyond that standard set of services, what else is included in the membership fee. If there are additional costs or additional services that DPCs offer, a lot of times you mentioned imaging. So oftentimes they'll charge a nominal fee for an X-ray, usually between $10 and $60, and that might not be part of the fee. But in Hint, we can set up plan rules so the employer can say, for any imaging that happens at the DPC, the member pays out of pocket, or we split it 50-50 with the member, or the employer will cover that based on kind of what the service is, the category, and the coverage level. So the employer would be able to take advantage of the DPC's kind of low-cost cash pay offerings beyond the core membership. Pharmacy, unless pharmacy is, there are some states that don't allow in-house dispensing, but usually low-cost pharmaceuticals are offered at no cost, and then kind of mid-tier to above would be the same as imaging. So the employer could set up the plan rules. Coaching is usually part of the DPC model. So coaching, health coaching, chronic disease coaching, weight loss, smoking cessation, that would all be included within the price. Those are all the questions that I have now. I think we've covered a lot. We're at 45 past the hour. What other questions do people have? Well, I really appreciate everyone who came to the session and spent the time with us. We'll send out the deck, we'll send out the library and our contact information. So if this resonates with you, get in touch, schedule a meeting. We can talk about, how we can bring this to your employers. And if you have other colleagues who may be interested in this, please pass it along. So thank you to Ji and Dr. Cameron. And behind the scenes, I actually have a producer, Alex, for this session. So thank you to Alex, too, for making this happen on this new technology for us. Okay. All right. Thanks, everybody. Take care.